When we get phone calls in, we will ask the question, can have an idea what it's about. Perfectly fine to say no, but it's really just to have an indication for where they are best highlighted to go to, so we can signpost them to the best healthcare professional.
Yeah, but the two main questions is it urgent for today? If they say yes, then when you ask, and what would you like me to put down as the reason, then that's when you find out the vital information, and then you kind of have like a generic discussion with them on the phone, and then they kind of reveal a little bit more information just through that conversation, and then you're able to better advise them.
I think obviously that is a big misconception that we're being nosy, that we're being obstructive, but it is really just to make sure that they get the right care, and that it's as quick and effectively and efficiently as we can make it.
I think a lot of it is the people just want you to listen to the whole story that they're trying to say, because that 9 times out of 10 is the main thing they say, is that people don't listen to them.
So we do get people asking for a phone call with the GP or an appointment with the GP, but they don't actually, they just think that's the automatic person that they need to see. But when we ask them the questions that we are asked to ask, it sometimes comes quite apparent that even it's a lot of the time we find that it's medication, but we've got a pharmacy hub now for that, and they are really good, and they have a lot of appointments. They know exactly what they're talking about, and then we can book it in for them for even just a phone call. They don't always have to come for a face-to-face either. But it also means that it frees up a GP appointment, which might be something that's more needed for a GP rather than filling up. So you've got 3 weeks till the GP appointment because there's people in for medication reviews, which could be in with a pharmacist.
A lot of it is because people know each other and they're frightened. Obviously it gets discussed out with, but we're all bound by confidentiality.
Yeah, confidentiality is like our utmost importance. We obviously ask these questions, and we can understand why people are a bit weary, because we live in a small rural area, and a lot of our patients know like people that we work with as well, but it's confidential, and it's a safe place. We're here to help and care for you, so that's why we need to do it, and we want you to have the trust in us as well. That you think that you're just going to speaking to patients all the time, but you can be speaking to different healthcare professionals. You can be speaking to a paramedic that's a patient that you're at. You could be speaking to the pharmacy, liaising with like they need a prescription. We have like healthcare board, health board rooms. So like we have to book them in as well, so that they are utilised for other outside people coming in for like drug and alcohol, primary care mental health nurse, the midwife. So it's not just phoning and making appointments or answering and making appointments. It's like dealing with loads of different health. Like I had somebody phone looking for a number from the Western General for a patient we've done a referral to. Like, so you're speaking to loads of different healthcare professionals in a day.